Hello and welcome to our panel of the 2021 Minority Veterans of America Equity, Inclusion, and Justice Summit. We'll be discussing mental health, substance use, and the disproportionate effects on minority veterans. In the veteran community, mental health and substance use has long been topics of discussion with the focus on resources and funding. Minority veterans have historically been forced to contort themselves to secure even baseline access to care. I'll be moderating our amazing conversation today. My name is Katrina Stroll, and my pronouns are they, she. I'm a US Navy veteran who served as an aviation structural mechanic. Now with years of HR experience and a passion for psychological safety, I continue to serve others through my services and my podcast, Absolutely Not. I am so honored to share space with the amazing panelists we have available for you today, and I'm thrilled to introduce them. Our first panelist is Eric Galnick. His pronouns are he, him. Eric founded Forge Health after his own experience overcoming trauma and alcohol misuse. Since 2016, he has opened multiple outpatient treatment facilities specifically for veterans, first responders, and their families. He is passionate about working to ensure underserved veteran populations get adequate mental health care. Thanks, Eric. Our next panelist is Timothy Jones. His pronouns are he, him. In 1999, while serving on active duty, Timothy was stalked, raped, and hazed. These traumatic events altered the next 20 years of his life. After receiving assistance from the Department of Veteran Affairs, Timothy navigated each adversity, reclaiming his colorful voice. Today, Timothy's purpose and mission is to inspire hope and empower healing of those who have had encounters with post-traumatic stress, PTS, and sexual assault. Our next panelist is Sherman Gillums, he, him, leads strategy and operations for the National Alliance on Mental Illness, NAMI, where he strategized the organization's realignment and spearheaded its 5-year strategic plan. He currently oversees the organization's efforts to universalize timely access to appropriate mental health care for underserved communities and the destigmatization of mental illness. Our final panelist is LaTonya Tripp Dinkins, she, her. She is a licensed professional counselor, a master addiction counselor, and a national certified counselor. She has extensive experience in working with military members with substance use and other disorders. She is a retired Army captain and holds a bachelor's in psychology, a master's in mental health counseling, and is currently pursuing a doctorate in integrated behavioral health. Thank you all so much for joining us here today. We are so excited to jump into this discussion. Okay, great. Now that we all know everybody here today, I'd love to jump into the first question. That question is, could you share a little bit about yourself, the area of expertise, and your area of expertise, and how you came to be involved? I'd love to start with you, Sherman.
Thank you so much. I'm glad to be here to carry forward what will be an important message for a lot of folks who will be lifted by this conversation. One of the aspects that distinguish NAMI, the organization for which I work, from many other mental health organizations is our focus on advocacy through what we call lived experiences. We just talked about the way we term things as disorders or other ways we make the noun the condition instead of the noun being the person that we need to focus on. And one of the magic behind our work is that we don't just give a voice to those who live with those mental health conditions, experiences, and challenges. We are those people. We are those people. So when I attend or present at events where topics like post-traumatic stress, depression, anxiety, and addiction are the focus, and those are the four most common conditions among veterans, I speak on the prevalence, the impact, and challenges as a person who can take what they mean out of the abstract and give words in 3 dimensions to people that see me, and in turn, the people who live with those experiences and not the condition. But the real benefit is we own our narrative, and we're proud of how far we've come. And I love jumping back into the hole to show someone how to get out of it, right? Because I was there. So for the last 17 years, I call this my work, not my job. I'll say, I don't work for the income. I work for the outcome, and it's to foster as many restored lives as possible by the time I take my last breath on this earth.
Ooh, Sherman. Okay. And that's how we're kicking this off, ladies, folks, gentlemen of everybody who's in here. I'd love to hear from you, Latonya.
Okay, well, Sherman said, and thank you so much, Sherman. And you said this is your work, and I call it my mission. When I returned from deployment years ago, my current work is a psychological health coordinator for the Georgia Army National Guard. And when I returned from deployment years ago, I came back and I was told, go home for 90 days. There weren't any services. No one checked on me for those 90 days. No one knew what was going on. And so I call it my mission because I made a decision at that moment that I will never leave another soldier or service member behind, that I will always go back and pull someone up. And so when this position became available, they reached out to me and asked, would you come on and be the psychological health or director of psychological health for the National Guard? And at that moment, I decided to change policy, because what I realized is if we don't change policy, we cannot make change down the line. In order for me to help someone else, I need to make changes in the way we do business. And that's destigmatizing behavior health. That's reaching out. That's checking on a battle buddy and ensuring that that is happening across the board. So I will continue my mission through what I do for the Guard, what I do for veterans and service members in my private practice, and what I do within my community. So it is my mission. So thank you, Sherman, for leading me into that with your work and my mission.
Ooh, I love it. I love it. So many powerful words. And I'd love to hear from you, Eric, and the work that you're doing.
How do you even follow those two? Are you kidding me?
I'm glad I don't have to.
That's right. No. And I think it's a very similar theme, right? This is, I was in the Navy. I had a very traumatic experience and I struggled to get resources, especially as an LGBTQ vet. And so for me, what I saw and what my best friend and I started this, we're both veterans. It was, hey, we have a lot of friends that are struggling. What can we do? And it's that next mission, right? And from trauma, there's growth, right? That's the next piece. Is the military is not the last chapter. You have many chapters after this, right? And in the service of others, I think that's where a lot of this comes from, is where can we help? Where can we provide that guidance, that strength to show people what we can get through? And I think Latonya and Sherman hit it perfectly. I think that's why a lot of us are in this, right?
And I'm so glad that you all are the people doing this work, because it sounds like y'all are passionate as hell about it. Timothy, I'd love to hear from you about your work.
No rookie mistakes here. First of all, go Navy. It was a conversation that took place. I was in the Veterans Resource Center, and I would never forget that this 20-year veteran, as I requested a meeting, just said, oh, Timothy, that's the guy with that colorful background. And I would never forget the connotation in which he used it. And at that point, he had no idea that I was homeless, but I wore all of that on my sleeve. And through this journey of 20 years, first of all, Sherman, on time, all of you, thank you for your work and passion, because it's your work that found me all these years ago. But it was because of that I said I never wanted another veteran, another person to relive my experience, because that was hell. And that, no, this cycle is going to break, and I'm going to be part of the cycle be part of the change that breaks the cycle and the change. And that's why I got into this work of homelessness, sexual assault, mental health, and mental wellness, just by seeing so many amazing advocates and survivors, now thrivers before me, do the work. That's how I knew I could do it, because I saw them do it, and I saw me in them, because they are me, for one.
Okay, and I will take that with as much grace as I can in this moment. They are me, all of your stories, that was the key factor in all of them, is they are me. We are trying to make a better space for veterans who have or are still going through the conditions that we had to face. Oh, okay, amazing answers to that question. I'd love to move forward to a specific question for you, Sherman. Your current work with NAMI is to help organizations support and create access to mental health care for underserved communities. What is the greatest challenges you see minority veterans facing in getting access to healthcare, mental health care?
Yeah, I'm gonna sit in this question a little bit because it's probably the most important thing we'll talk about. The challenges are many, but the greatest one, in my view, is how we talk about mental illness in our society. Many people think it's rare, something that only happens to people with life situations that are different from their own, or because of judgments or choices and things like that, and that'll never affect them. However, it's so common, it's almost invisible. Most families are touched by mental illness in a way that that they may not want to admit, or when they think about it, then they understand how prevalent it is. Some folks forget that the worst of 2020 didn't start with COVID-19. It was 12 ballistic missiles from Iran that hit our troops. So we've been in, stress and anxiety for a while. And then, the 50 million we typically see a year on a normal year, now we're talking about a pandemic that has persisted for 2 years. And so when you think about the prevalence in the first place and you add to that, it's like I said, it's so prevalent that it's invisible. And then you add to that the problem that people with mental health conditions all too often don't get the help or the response they need when experiencing a crisis. They're more likely to come in contact with law enforcement, and we've heard all the stories. And for the ones that don't, they end up in emergency rooms or in psychiatric hospitals where they're treating the behavior, not giving them the ability to cope with the condition. People see this and avoid becoming, quote, one of those people. And so when they are experiencing hardship, we feel depression, but we hide it behind a smile or painkillers. We feel anxiety, but we can smoke a cigarette or pop a pill to mask it. We feel a trauma response, but we can soothe it with alcohol and sleeping pills. And we do all those things in hope of never letting the world see what's wrong with us. But being our authentic self and living our truth means fitting a label of somebody who isn't broken or out of place or abnormal. And that's what drives people into isolation and detachment, where denial and self-medication and addiction and suffering in silence fill that void. And they wear masks for so long that they don't recognize themselves if they were to remove them. All right. And I'll end with, we're living in a period where we become familiar with the catchphrase, "You're on mute." And we fix that by pressing a button, right? We hit the little icon. For a lot of people, they've been living their lives on mute and they couldn't hit a button and be heard. Now that we know what it feels like to be on mute, to want to say something and be stifled, it's symbolic of maybe some understanding. Now we'll have a better appreciation for what that feels like when people walk that experience every day of their lives.
Charmaine. Okay. That mute button part really hit me. And I hope it hit everybody in the room today, because there's probably somebody in your office, there's probably somebody in your organization, there's probably somebody you've spoken to today that is living their life on mute. Thank you so much, Sherman, for the words. I will now move into LaTonya. With that mute button in mind, you work with people who have continuously worn the mask, who are continuously on mute, or making sure that they look strong and steady on a daily basis. And because of that, they have turned to substance use or misuse. How has that disproportionately impacted minority veterans?
Okay. Thank you. And thank you, Sherman. I mean, unmute, that was very powerful. And it definitely hit home. And I always try to reflect on service members, either whom I served with or whom I've treated. And I'm going to talk about a particular soldier. I was the XO in an infantry brigade, and the soldier tested positive twice for 22-year-old Black male, tested positive twice for marijuana. And the first time he tested positive, he came up to me and he said, "Ma'am, I I've smoked on the way to drill. I've smoked in the car, in the parking lot, but I didn't smoke that day. And I said, okay, you didn't smoke that day, but let's see what we could do. And so we met with him. We referred him to services. We referred him through our SAP program, just substance abuse, but it's use disorder program. And so we referred him to treatment that he would go and he would pay $40 a week to go to this treatment. So he tested positive again for marijuana. And when he came back, his only concern was, what type of discharge would I get? And I kept thinking, I'm like, why are you concerned about the discharge? Like, this is your career. You are about to be discharged. He followed me around every day. Every time he saw me come out the office, he said, have you all made a decision on what type of discharge I would get? So finally, we made the decision to, it came down that he would get an administrative discharge. So once I told him that, he said, cool, I'm glad. And I thought about it and I said, you're glad that you're getting a discharge? He said, yes, because that's an administrative discharge. That means I could still get a job. I live in rural Georgia. I am 22, I'm Black. My mom and dad smoke and drink. My cousins smoke and drink. My family smoke and drink. I don't know what to do. You all sent me to services that I had to pay $40. Ma'am, I only make $4.25 an hour. I can't afford to pay that. I'm hitching rides to come to drill. I can't afford to get there. And I thought about it and I reflected on it. And that was a few years ago. And I thought about what we're doing, how we're setting them up. Are we giving them access to care? Are we giving them the appropriate resources within the community? Are we looking at the big picture? Are we looking at the whole person? This particular, culturally, we're unable to provide for him because if he goes back into his community, that is all he sees. If he doesn't have a ride to drill, we're expecting him to be able to get to resources in a rural town where probably 4 clinicians in that town, and maybe 1 or 2 of them provide services for substance use, and he can't afford that either. But yet we stand in the formation, and there have been service members that have showed up smelling like alcohol. They get connected to resources. There's no discharge because we don't screen for alcohol use. We screen for drugs and marijuana. And so when they test positive for drugs, they are penalized. But when they show up drunk, we send them home to sober up. It's a cultural shift. So as we look at what we could do to help those within these rural communities, these minorities that are trying to access care, we are more stigmatizing of marijuana usage than we are of alcohol usage. And our service members are being disproportionately discharged from armed forces because of their culture and their substance of choice. We have to make a shift. So as I think about how can I support them, we got to look at access to care. We got to look at, are we appropriately providing the appropriate services? And are we supporting that particular service member as we would support their counterparts standing in the formation with them?
Let me clutch my invisible pearls. I cannot thank you enough. And we talked about the language before we headed into this panel around substance use. When people hear the word substance, what are they thinking of? When people hear the word substance abuse, what are they thinking of? And quite frankly, I've seen that happen so often in the ranks. They treat the 2 substances very differently. Thank you so much for bringing that to the table for everyone in the room to digest it as they have time to. I cannot thank you enough. Eric, I'll move on to you and ask, we know that substance use disorder and the use of it disproportionately impacts minority veterans. How do lived experiences of minority veteran populations create a higher rate of substance use in their communities?
Yeah, so, and I think just to go back real quick to what Latanya said about access, right? And what you said about the use of words, just briefly, if you don't mind, I want to touch on that. It's so important. It's so important how we look at how access to care is being, not just culturally competent access to care, but how providers are looking at substance use, right? If you're going to a place and it's not a harm reduction program, the harm reduction meaning like you are getting treatment for the issue that you're working on, and you're not getting a moralistic lecture about what you do. This is a disease model, right? This is a disease. So I just wanted to jump on that real quick. To answer your question, I think it's twofold, right? I think the first is, I always say that mental health and substance use is a disease of isolation, right? In a lot of these underserved populations, in minority populations, there's isolation, right? Once you leave the military, once you leave that kind of, that part of that tribe of the military, you already feel kind of marginalized in a bit in the military, but once you leave that, it's even worse, right? So there's that isolation feeling that can do it. There's also trauma, right? The baseline trauma that we all go through at some point. I think for underserved populations, marginalized populations, that trauma is the through line that we see through a lot of this stuff, right? So I think looking at trauma as kind of the baseline, right? On when we look at and we try to treat substance use and we try to treat mental health, those lived experiences are different than what the healthcare system currently looks at, right? And I think that's when we go back, and I know Sherman's working on this with NAMI, it's that mental health parity, right? Where we're looking at, hey, getting sick with a disease is the same as getting sick with a mental health issue. And looking at those populations, that needs to be communicated, right? So I think it's sorry, I didn't give like a clear answer, but there's so many pieces to it that it's hard. I think we as a community and folks that are working on this, we have to take these things one thing at a time and work through it as we're doing it, right?
And the word we have all used throughout this conversation is culture. The culture around mental health, the culture around substance use, the culture around just the individuals who are moving forward and what they're being depicted as people who are not a part of those communities, and the biases that come with that. I love that we are breaking it down for everybody in the audience. I do have a question for Timothy. Timothy, your story of your trauma while you endure, the trauma that you endured while in uniform is heart-wrenching, to say the very least. You shared that substance use was a big part of your journey. Do you feel you had the adequate resources available for you throughout your journey?
So the answer to the first part of that answer is no. From the beginning of my journey, there were no adequate resources. When I reported my assault and everything that happened, I was paired with a chaplain, because at the time of my service, I was serving right under Don't Ask, Don't Tell, right in 1998. At that time, unfortunately, Barry Winchell was sadly taken from us because of the thought of him being gay. So that was the culture that I served under. And when and I have to shout out these amazing heroes in my life, because they were part of the domino effect of my transformation. First, that was Master Chief Ted Kabbalah, because he fought for me to get an honorable discharge when my CO wanted to give me a dishonorable discharge because of homosexual conduct /acts, not because I was sexually assaulted by a same-sex individual. So Mr. Ted Kabbalah, Anthony Kelly, Jim Yauger, most importantly, my guardian angel, my mom, and my family, because every time that I needed to come home to reset and I was truthful and authentic of where I was in my journey, she told me to come home. I didn't have the resources. I had to look for them. I had to create them. I didn't have mentors in Pensacola. I had to go to Google headquarters in Mountain View, California, just so that I could find other individuals that I could look to for support or to mirror, because I wanted to mirror positive behavior, because I had made a commitment to transform my life. today, these last 9 months, today I'm celebrating 9 months of sobriety from alcohol. And this is the first time in 20 plus years that I've ever received treatment for alcohol. Everyone likes to talk about the resources that are available, but nobody asks, what have you tried? Or what is your knowledge of that? Because in our communities, we don't talk about that. Those resources, they didn't look like me. They didn't sound like me. Hell, I was going to college and people told me I couldn't be a veteran because I didn't sound like a veteran. You know, the visual effects, and it's so amazing to see today all of these advocates, all of these change agents who are working to transform the culture, because it's through that work that I can confidently say that I do have the resources and support today that allows me to be in the driver's seat of my life. What I had to understand and what I've come to know, and I didn't even realize that I was doing it, but my core values were hope, healing, and action. I had always hoped, no matter what I saw in front of me, that there had to be a better tomorrow or a better way. I just believed in that. And as I started the process of healing, then it's almost like all the resources I didn't know were available began popping up before my eyes. And I'm like, well, where the hell have you been? And I realized that I wasn't ready to hear a lot of the things that were being said because I couldn't undo just my journey at that moment. But today I feel so good to be able to say that there are resources, they are improving. No one's perfect, but they are much better than where they were when I started this journey in 1999.
I cannot thank you enough for sharing your journey with us today. Congratulations on your 9 months. Thank you so much for celebrating with us today. Throughout this conversation, one, I have been on an emotional roller coaster this entire time, so thank y'all for that. But also, we have been able to share so much of the advocacy and kind of the language and the culture and where it's moving forward to here today in 2021. Some people in the chat, we have some questions and they are fearful of moving forward with their own personal journey. So I will ask some questions on their behalf to everybody in the panel. LaSonia, I'd love for you to answer this question particularly. How would you take the first step in getting help with drug abuse without feeling you're a burden to your team and others around you?
So that's a good question. It's a heavy one. And I always reflect on the courage of other people that have become before me, but that came before me. And I think about this soldier and a lot of them that never gave up, that never stopped asking, even when doors were closed, even when they didn't feel as if they were getting heard, there was always another door. So I would challenge anyone to keep pushing, to keep asking, to make your own way, to carve out another door if you have to, because there is access. We just don't always know what the resources are. And if we don't ask about the resources, we're never going to get to the resources. So I would encourage other people to have that courage and that intestinal fortitude to keep asking and keep pushing.
Thank you so much. And I know we're all veterans here, so we know there are definitely going to be people in your commands and your organizations who don't give a shit about you and will probably tell you to stop asking. But what she is letting you know today is we can't let that stop us. You have to move forward. You have to care about your health overall. Thank you so much. Sherman, I would love for your answer for this question. As administrations change and they change their resources, they get reallocated and modified. How can we remain focused on our goals for minority veterans so that they and the progress already made doesn't disappear?
I'm gonna get a little philosophical because I've seen several administrations, and you're right, a lot of it is about expediency for them. As soon as they win, they're thinking about that next election. That's why it's not a government problem. It's a problem within a community. It's about us being our own best advocates. That's why we got to jump back into the hole. That's why I honor what Timothy talked about, because what he displayed there was strength, and there are going to be people watching that who will be, we talk about getting radicalized in a whole lot of other ways. Well, we need to radicalize people who have known hardship and pain, but need somewhere to expend that energy. And once they get help, where do they channel it? Well, that's how you make ambassadors out of people who have lived that life, who are about that life. And if we focus more on communities and less on government programs, then we disempower the system's ability to limit us to statistics and to data points, and instead become human beings. And the governance is really about us between ourselves and who we are to each other, not how a social structure looks at us and how they make use of us. And so when you hear about what some program did, but you can't meet an individual who was changed by it, then don't put your faith in a program. Believe in your own ability to connect with somebody and help pull that person through.
Hey, I'm not, I will not add any more sugar to that sundae because it's good to go. Thank you so much for that, Sherman. For everyone out there, the continuous message we are hearing for our panelists is keep going, do it for yourself, do it for your community, advocate for yourself first and foremost, and the rest will follow suit. Oh, that's not a promise though. I would love for you, Eric, to answer this question from the audience. What types of resources are out there for minority veterans who have substance use issues?
Yeah, this is a tough question, right? There's the short answer is not a lot right now, right? I think what Timothy said is right on target, that it's gotten better, right? But I know when I got out and I was looking for help for substance use as an LGBTQ vet, I didn't feel very comfortable going to a VA and doing group therapy, right? So I think it's getting better. I think there are between veteran service organizations and the VA certain programs in certain areas. It's location dependent, right, on where those areas are, where those good resources are. But I think the most important thing, and I think LaTanya and Timothy both said, is taking that first step, right? You need to start looking for those resources, right? I'll give you an example. When I went to my psychologist outside of the VA system, right, and went into the community, the guy goes, "Oh, okay, so I figure when you were murdering people in the military, this is where all this came from." You're like, what? Right? But it just goes to show you that it's that lack of understanding, right? So I was drinking a bottle of whiskey a day to go to sleep, right? And the first thing I did after I had that meeting was go and drink again, right? But the next morning, I woke up and said, "Hey, okay, we need to get back up and keep looking," right? So I think leveraging some of the organizations like Minority Veterans of America and looking at those resources as a starting point is super important, right? But don't give up after the first time. That's my, I guess, the main message is don't give up, keep looking for those services, right?
Thank you so much, Eric. And I love your use of the phrase starting point. That happens to a lot of minority veterans. That has to be our starting point, but we can't hold on a system that's already kind of plagued with white supremacy. Okay. So we do have to look elsewhere, but this is a great starting point. Thank you so much for that. Timothy, I'd love for you to answer this question. How can we further help those around see that mental health is not a race-based issue, that it is a human issue?
Ooh, well, I love that one. We got to start being more human. That is the key. We got to start being more human. You know, a lot of us, and myself included, for a long time, I talked the talk. Even when I got sober the first time, you know what? I talked the talk and it was great, but it wasn't my choice. I didn't walk the walk. I didn't do the work. I didn't do the real work. And a lot of people I love what you said, Sherman, earlier, man. If you don't see someone that can speak to the experience of the program, you need to find a new program. Every resource that I've utilized, I either work for now with VOP or I'm a part of it in VA or SVA because their programs work. NAMI, the resources worked. But I had to make a choice first that I was going to do this for me, and it was going to be no matter what. And everything that I've gone through made so much sense. And then when I made the decision on February 13th to stop drinking, for me, now everything is almost like crystal clear with how life is going to be. To answer the question, and I go off on tangents, repeat that question one more time.
Just how do we get people to see that this is not a race issue, but mental health issues are human issues overall?
Vulnerability is not weakness, and neither is kindness. And when we stand on our stories and stand in our power, that is how we can create more human interaction. And that is part of being the change. That is part of being part of the community, the global community that is us. And we got to start realizing that we are not separate. We are one. We are one. And if the brother or sister or our family next to us cannot access the services, then we cannot. And that is when we can really spur that change and move forward. But understanding that we've got to be more human.
Thank you so much. And there is a big push currently for authenticity, vulnerability. And I love that you broke it down for us. It literally just means advocating for yourself, being your true self, and standing in your truth and your experiences and your ability to share them with others. You really brought it full circle with it. Just be your damn, be a human, be the human being that you are. I cannot thank you enough. LaTonya, if you could answer this question. Working with veterans in employment services, I am concerned about addressing their needs, including mental health. Can you please provide some tips about having those delicate conversations to keep them engaged so that they can be referred to appropriate resources?
Okay. I would say listen. I mean, we spend more time thinking that we know what's best for them, and we're not really listening to what their needs are. And when we listen, we're actively listening, but we're also taking action based on what they're saying they need. For instance, I had a service member, we put him in 3 different substance use disorder treatment facilities in a span of a year. And so we decided, the military decided, okay, he is, how do they put it? They said that he had several failed attempts. He isn't able to rehab. So we're going to discharge him from the military. And so he was an 18-year vet with 3 deployments, 2 infantry deployments. And he called me one day and he said, "You all have put me in substance use treatment. Now you're going to discharge me from the military." He said, no, hold up. I know my rights. I have 18 years of experience, so I'm sanctuary. But I also got blown up in a Humvee accident and nobody ever looked to see if I had a TBI. And so when I called back to his brigade, I said, "Hey, do we have any LODs on line of duties on this soldier?" And they said, "Well, I think he did have some LODs." I said, "But his diagnosis has been substance use disorder. We don't have a TBI disorder. We need to see if we rehabilitate him as far as mental health issues while we're working on substance use issues. We need to treat both." He was advocating for himself. That made me, as a clinician, stop and listen. It took his family, his support system. So I think that is important, to have your support system. When you can't do it, you have someone else leading the charge. His wife said, "Wait a minute, he needs help beyond substance use." So we were able to pull it back. But if I had not listened, that service member would be discharged today. If we had not stopped, slowed down the ball, that service member would be sitting at home with no VA benefits because he was getting discharged dishonorably based on his behaviors and his failure to rehabilitate. We have to take a step back as providers, as the helpers in the profession, stop, ask them, what do they need? Let them drive their care. If we allow people to drive their own care, then we will get to the finish line together, and it's not just guided by us as the professionals.
I love that so much. It hits on so many levels for the people out there that are currently going through the situation, for the providers out there in the audience, for the people who are living with people with conditions. It hits on so many levels. So thank you so much for that insight. We are about to wrap it up today. So I'll save this last question for you all. For anybody in the audience today that's part of our community, the veteran community, but maybe minority, they're living with mental health conditions, or they're battling with substance abuse currently, what should they be doing to find help? Where can they find help? I'd love to hear from you, Timothy.
The first thing that they should be doing is, first of all, being patient with themselves as they begin to love themselves and to fall madly, passionately in love with yourself again. Because we can recover, we do recover. And for anyone out there struggling, know that we see you, we hear you, we all feel you, because we're one. So we're in this, well, it's all we do this, we're one. And know that we value you. And you're not on this journey alone.
Thank you so much, Timothy. Eric?
Yeah, I mean, Timothy, you're right on target, right? And that's as a community, right? I think you and I both have a very similar experience, and we are here for a reason. We are proof that you can get on the other side. And again, I always go back to, this is not your last chapter. There are many chapters in your life, and taking that first step is important. But lean on the community, lean on us, lean on people that have been through this to get you through that next step.
Thank you so much, Eric. Sherman?
Oh, all of us will earn induction into life's hall of pain as a consequence of living at one point or another. And no matter how many times you fall off the wagon or fall short of your desire to break an addiction, I want folks to remember it's never about what's wrong with you. It's about what happened to you, and how do you find a way to be okay with yourself despite all that happened. And it's often the first step toward embracing a support network that you feel like you deserve. As Timothy said, learning to fall in love with the person staring back at you in the mirror, and deciding that even though we know ourselves to be conditioned by our lived experiences and hardships, we don't have to be determined by them. Thank you.
Thank you so much, Sherman. And LaTonya, to close us out.
I think enough has been said. I think I can't follow. I mean, I just, again, don't give up, ask, push through the doors, push through the barriers. That's the only way you would get your needs met. Just don't be afraid. And I just kind of follow all of these guys, because their courage is strength to someone else.
Okay, y'all. Thank you so much for joining us today. This has been amazing, insightful in so many ways, inspiring to say the very least. Thank you all panelists for being just so open and willing to give us the knowledge that you've learned throughout your journeys. I hope, if anything, if nothing, you take away that you are in the driver's seat of this journey. Advocate for yourselves, advocate for others if you can, and find those resources your damn self, because sometimes they won't come and fall into your lap, but we are here with you as a community, helping you provide those resources to move forward. This has been an amazing panel, and we hope you stick around for the rest of the summit and the rest of the panels here. But if not, thanks so much for joining us. Bye, all.